I think God has a plan for all of us, truth be told. I didn't know what I wanted to do, but unfortunately, when I was a junior and senior in high school, I had a lot of family members that got sick. My grandpa, my uncle, just a lot of people in the hospital all at the same time, it seemed. And I just found myself really having a good time talking with the doctors, not necessarily the fact that my family members were sick, but just having conversations, talking with them, learning. My dad and the general surgeon in my hometown actually were Pee-wee football coaches together. And so when I was trying to figure out, okay, I want to do medicine, how do I get my foot in the door to figure things out? And the general surgeon in my hometown of 10,000 people, basically, he was like, yeah, come shadow me, that's fine. And I knew nothing about surgery at that point, but I fell in love with the OR. I fell in love with his confidence. I fell in love with the fact that he was active. He'd see a patient, they'd have a problem, he'd fix it, they'd get better. I love the fact that you're actively fixing a problem. I love the fact that you see a patient, they have a hernia, they have cancer. You can go in, you can do something about it, and then they get better. And then they are grateful for that. So I love the active part of surgery. I love the fact that you can make somebody better by actively doing something to them, and it never changed. You have to take care of the whole person. Not only is there a patient, but the patient has not just the problem you're taking care of, but they have family, they have their social situation, economic situation. For most people, at least in the Midwest and Kansas, faith was a big part of that, and you have to take care of that whole aspect of the patient. You have to realize again that they're a human being, they're a person, they're not just a surgical problem. And you have to have every one of those parts of their care involved in their whole care and recovery.